Good day everyone, my name is Sharon Delajero from Basin 1B, and for today's video, I will perform the vital signs taking temperature, pulse, respiration, and blood pressure. Definition: vital sign is a procedure that it provides that reflect the status of several body systems that includes cardiovascular, neurologic, peripheral vascular, and respiratory system. The sign of the basic psychology is effective in body temperature, pulse, respiration, and blood pressure. Measure temperature, first followed by pulse, respiration, blood pressure, and oxygen saturation or SpO2. And its purpose is to assess the clients in a condition, to determine the baseline values for future comparisons, to detect changes and abnormalities in the condition of the heart. So the materials and equipment of this is including the thermometer, tympanic thermometer, the digital oral, axillary and rectal thermometer, and one stethoscope, sphygmomanometer with appropriate cup size, and watch with the second hand, pulse oximeter, swab or cotton ball with alcohol, paper with bag, record form sheet, ballpoint pen like blue, black, red, and one tray to set all equipment needed in that term paper. Measuring temperature or temperature taking. So its definition is the process of measuring or monitoring the patient body temperature using a medical thermometer. It may be taken through the axilla or the orally or through the tympanic membrane. So its purpose is to determine the body temperature, to assess and diagnosis, to evaluate patients to recovery from illness, to determine if immediate measures should be implemented to reduce dangerously elevated body temperature or conserve body heat. Body temperature is dangerously low, and to evaluate patients' response once hypothermia or heat reducing measures have been implemented. So the temperature below 36.7 degrees centigrade or 98.0 degrees, and the temperature above 38.3 degrees centigrade or 100.9 degrees represent hyperthermia.
Check the client's identification. Good morning, ma'am. My name is Sherilyn Delajero. I am your nurse for today, and I just want you to know that I am here to taking auxiliary temperature for you, for me to know that if you have a fever or hyperthermia. Take the thermometer and wipe it with the cotton swab from bulb towards the handle. Press the button that will erase the digital numeric display. Assess the client to a supine or sitting position. Assess the client to supine or sitting position. Hold the thermometer in a place until you hear a beep sound. Remove the thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. Explain the result and instruct the patient if he or she has fever or hypothermia. The client's identification. Explain your purpose and procedure to the client. Close the doors or use a screen. Take the thermometer and wipe it with cotton swab from bulb towards the handle. Test the client supine or sitting position. Ask the patient to open his or her mouth. Place the thermometer under the client's tongue, to the right or left, or the frenulum deep in the posterior sublingual pocket. Ask the client to close her or her lips around the probe. Hold on the thermometer in place until you hear the beep sound. Thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. Disinfect the thermometer, take the thermometer and wipe it. Explain the result and instruct the patient if he or she has a fever or hypothermia. Dispose the soil materials properly. Wash your hands. Return all the equipment to its proper place. Check the client's identification, explains the purpose and the procedure to the client. Also close the door or use a screen. Take the thermometer and wipe it with a cotton swab from bulb towards the handle. Wear gloves. Press the button that will erase the digital numeric display. Position the client's same sideline position with the upper leg slightly flexed. Drape the client by exposing the anal area only. Lubricate the thermometer bulb around 2.5 cm or 1 inch. With non-dominant hand, separate client's buttocks to expose anus. Gently insert the bulb into anus around 3.8 or 1.5 inch. Remove thermometer and wipe off any secretion from stem towards the bulb with a rotating motion using a cotton ball. Soak with alcohol. Red thermometer. Wipe client's anal area with soft tissue. Temperature and effect signature on the chart. Report an abnormal reading to the senior staff. Identify the client and explain the procedure. Have the patient rest her arm alongside of the body with the wrist extended and the palm of the hands downward. Place the tips of your middle 3 fingers on the palm side, the patient's wrist thumb on the back of the patient's wrist. Apply enough pressure so that you can feel the pulse, or not too hard, not too light. Identify client and explain the procedure. Hold the client's wrist just as if you were taking his or her pulse. Note the rise and fall of the client's chest. Using a watch with the second hand, wash your hands. Evaluate the character of respiration and documentation. Record the character of the deep respiration.